John, could you tell everybody a little bit about the rationale and the drugs involved in this clinical trial design?
Yeah, absolutely. Thank you, Nataliya. So this is a really interesting trial that builds off of significant progress that's been made in the treatment of bile duct or biliary tract cancers. So right now in clinic, we treat these cancers with a combination of 2 chemotherapy medicines, and we add an immune boosting medicine, either durvalumab or pembrolizumab, to the mix to try to get the immune system in the game in order to target cancer cells. And that's based off of a study called Topaz, as well as another study, Keynote 966, which studied the pembrolizumab checkpoint inhibitor that showed that adding these immune boosting medications to the mixture could help people to live longer. But what we're seeing is, that our hope is that we can do more to help patients live even longer. So we're seeing, there is a way to engage the immune system in biliary tract cancers, but we know that the cancer itself produces a lot of things that get into the microenvironment that make it really challenging to produce a sustained immune response. So we can try to turn on T cells, we can try to turn on NK cells, but we can only do that successfully if we're addressing multiple factors that the tumor is producing to sort of shut down those immune responses. So this trial looks at the addition of what's called a CD73 inhibitor called quemliclustat, in addition to a checkpoint inhibitor, which is similar to durvalumab and pembrolizumab called zimberelimab. And the idea here is when cancer cells die, they release a molecule called ATP into the microenvironment. That molecule normally is a red flag for the immune system that turns on the immune system and tells it to go after cancer cells. However, in bile duct cancers, the tumors have often evolved a way to turn that red flag signal, that ATP, into more of a green flag that turns off the immune system. So the ATP gets converted to a molecule called adenosine, which essentially shuts down T cell and NK responses. So this quemliclustat medicine blocks CD73, which is the enzyme that the tumor has that promotes that change from ATP to adenosine. So our hope is that this medication, together with a checkpoint inhibitor, will help the immune system to be more active and ultimately will help patients to live longer and live better.
Thanks, John. I think this is such a great summary of what this drug does and why we're using it here. I wanted to add that quemliclustat has already been in clinical trials, and actually this medication showed promising results in patients with pancreatic cancer. These are terrible tumors to treat, unresponsive to the addition of immunotherapy in prior studies, but a phase 2 study showed the promise of activity when quemliclustat, either alone or in combination with zimberelimab, was added to gemcitabine and Abraxane. And so given that promising data, we were even further inspired to use similar medication with a slightly different chemotherapy backbone, gemcitabine and cisplatin, which would be used to treat patients with biliary tract cancers. So this study is ongoing, and we launched it now in 4 sites, including our cancer center. And I think the first part of the study is, the first portion of the study will establish the safety of this combination. And then the primary endpoint is progression-free survival. So looking forward to seeing some of the results and getting patients hopefully better treatment.